Hi, everyone. Thanks for joining us. We are excited to have you all here. All right, while we're waiting for people to show up, can you put in the chat how long you've been with Young Living so we have an idea of who all's around? Ooh, 13 is so far the longest I'm seeing. Okay. All righty. Well, I'm going to get started because this is going to be a jam-packed call. This is our Spruce Society call. This first call is going to be just kind of a refresher course for everyone who's a brand partner. So if your brand's thinking new, you've been here for 13 years, we're just going to review all the ways that you can earn money and the newest ways that you can earn money. So my name is Carol Ye Garner. I am a Royal Crown Diamond. I started 10 years ago with no intention of doing this as a business. And yet here I am, top rank. So I am joined by a couple different people. I'm going to give you all the agenda of kind of how this call is going to work. The first part of it is just going to be reviewing the compensation plan. So Ali Raskin is here. She's going to be reviewing just kind of the overview of like how you earn money. And then we just recently had a couple comp plan updates. So she's going to highlight those so everybody's clear on that. Then Kelowna is going to be talking about the 14-day reset. So who in here has done a reset? Comment yes in the comments or raise your hand, whatever. 14-day reset is an amazing way to build your business. It happens every month. It's so duplicatable, and everybody that does a 14-day reset is going to have some kind of positive result. And so Kelowna is going to highlight all that, the reset, the 14-day reset, and all the resources there and how you can build a business. I'm going to go quickly over the health plan information just in case you missed it before, but we're going to just kind of talk about like how it came to be, what it is, what are the plans, and then Jessica Petty and Nathan Petty are going to come on and talk about just how you can build this business just with the health plan. They've got tons of great ideas, and we've got some scripts, we've got some trifold Canva templates that we're going to be sharing with you. And then the last part of it, we're going to leave open for Q&A. So Yvonne, my sister, is going to be helping to answer questions in the chat thread. But if you can wait till the last part of it, it would be way easier to just hold your questions till the very end so that multiple people aren't asking the same question over and over and over, and we're answering it over and over. Okay, so this is ideally going to be an hour long. So we're going to start with Ali and the comp plan. So let me.
Yes. Thanks for having me. Can you see me?
Yes.
Okay, so do you want me to cover the whole comp plan or just kind of updates? It sounds like there's people been around here for a while, so I don't want to waste anyone's time.
Yeah, just the, well, I mean, some people haven't been around since the 50% of the first month thing. So like the basics of how you get paid and then the updates. And I made you the host. So if you wanted to share your screen and show stuff, that'll
Perfect.
be there.
Okay, so I think that I Let me see here. Here, share screen. Okay. This is the, this is the updates. So I'm going to focus on the updates. And if anyone has questions, feel free to unmute yourself after I kind of go through this. So what I did is I actually created a book last year about this kind of the comp plan visually laid out, since we have such a lovely way that Young Living lays out our comp plan in that one sheeter. It's a little bit confusing. So I made a book that broke down each section of the comp plan. So I'm going to give you the fill of what has changed in the last year or so, and in what is going to be changing March 1st, most importantly. So starting with the fast start bonus. So when you enroll anyone as a brand new member, you are going to get a fast start bonus in the first 3 months as the enroller. In that first month, you're going to get 50% of their order. In the second month and the third month, you're going to get 25% of their order. If they purchase one of our premium starter bundles, you will also get an additional $25 on top of the fast start bonus. And those are bonuses. They are not commission. And that's really important to distinguish between those two words, because bonuses and commission are treated two different ways with Young Living. In order to get a bonus, you do not have to spend money with Young Living. So that's why bonus is important to use the words differently than commission. Okay, so when you enroll someone and that someone enrolls a friend, we have another bonus that you get 10% in months 1, 2, and 3, that your enrollees enroller or enrollers, whatever, the person that you enrolled, what they're buying, what their person they're buying. So sorry, we don't have a name for that bonus. So it's really confusing because there's not a word for that to use. So I wish we would just name that. Okay, so the second thing, let's see here, is commission. So we have bonuses and then we have commission. So commission, unilevel commission, is what you're paid on everyone in your organization every month after their first 3 months. You get paid on the percentage of what they purchase. So the higher rank you are, the deeper you get paid in your organization. And so it goes 8, then 5, then 4%, and then you're paid up to level 8 depending on your rank. So if you can see here, that from executive to RCD, you're paid up to level 5. And as you rank even higher, as you get paid even deeper, and which is a whole nother conversation. But for the purposes of what has changed is we're going back to how things were a couple of years ago before they updated our commissions plan. So now, in order to be paid, you do need to spend 100 PV a month to get commission, because it's very difficult to share things when you are not using them. So Young Living really wants you to be a product of the product. And I think that's really, really important that we are using the products that we're sharing. Personally, I find it inauthentic to sell something that I'm not using. So there's that. Okay. So when you are, the enroller, again, only makes the first 3 months commission. And then after that, your entire downline benefits from wherever they are in their downline if they're under you. Okay, let's see. Compression. All right, so compression is changing a little bit, and I'm going to do my best to explain compression. So compression has always been around with Young Living, meaning if someone did not order in your organization, you were not penalized for that. If someone on your level 3 did not order, and your level 4 acted like your level 3, and you were paid that percentage as if they were your level 3. What's changing with that is, in order to qualify for a rank and be paid as that rank, your top of your legs, which is this right here. So this is me. These are this would be my 4 legs. These people used to have to spend 100 PV or be qualified, a commission qualified, by having 100 CV, customer volume, under them. CV is going away, and we're going back to no CV. However, compression is improving, which is amazing. This is the best I think this is like such an amazing part of this new plan. So if this person has been around for a while and they've stepped away and they're no longer spending 100 PV, and they're not commit now, and now that CV has gone away, that this is not they don't have the customer volume, it does not matter anymore. What happens is the first leg that has 100 PV becomes one leg with whoever's on top of them. So I tried to simplify it in for the purposes of this diagram, but let's say that these three people or these two people don't have 100 PV, but this person has 100 PV. Can you see my mouse on the screen? Okay, good. Then these three people would count as your level 1. So you are no longer penalized for people not spending 100 PV. And this, I think, is going to have a huge jump in our paychecks. I cannot wait to see how this works out. It's pretty complicated to calculate. So I'm really looking forward to YL Insights going to calculate all that for us next month. So this is all starting in, all these changes are March 1st. Let's see here. Is there anything else? Let's see. Those are the 3 main updates. Are there any other questions that you think I need to cover, or does anyone have any questions about the changes and updates in the comp plan?
I think that's it. Those are the main biggies.
Okay.
Yeah.
I'll stop sharing then and hand it back over.
Yeah. All right. So next up, we've got Kelowna. She's going to highlight the 14-day reset and all the things that come with that. So let's see, there she is.
Hello. Hi. Thanks, Allie. That was awesome. I know everyone's been waiting for some of those changes, so it's really exciting that they're finally here. So how many people, raise your hand if you guys have participated in a 14-day reset? How many people have not, but maybe you've heard of the reset? So the 14-day reset is such an awesome way to get enrollments, to get people reactivating, and just get people really on track with their health. I'm just going to review it really quickly. And shout out to the group of people who were instrumental in bringing this to Young Living on a big level, because there was a team of people that were using this all last year and getting tons of enrollments. They were brand partners that were getting, winning the trips and getting to go on the incentive trips because they were enrolling so many people. And it was wildly successful. They put in a ton of work. And the nice thing about it is that everything's kind of done for you. You just get people to buy their Ningxia, plug them into the group, and they have a ton of support. You also get like this packet that you can print up for people who want like a printed version of something to be able to go through. It's like very tangible. It's plenty long. It has lots of detail, and it gives people something just to guide them along the way. So what the reset is, it's a plan that lasts for 2 weeks, 14 days, and it involves 4 parts. So one is drinking Ningxia Red, and it has you drinking quite a bit of Ningxia. So you're going to have to listen to your body and, keep up with the program as much as you can, but back off if you need to. I mean, some people just have to modify a little bit, but it has you drinking more Ningxia than maybe some of us have drank, at least in the first couple days. And then it tapers off a little bit. So drinking Ningxia is just one part. The next part is drinking half your body weight in ounces of water. So that can be a challenge for some people, but super beneficial for our health. Definitely, there's lots of tips and tricks in the group to help you drink more water, like using Vitality drops or sprinkling a little bit of salt to get the electrolytes and all of that. And then the third part is eating clean and really removing inflammatory foods. And there's a bunch of different meal choices that you can pick. And so depending on what your different dietary needs are, there's something for everyone. So it's really helpful to have specific plans and specific information. And there's tons of that in the group and in this packet. And then the fourth part is moving your body for 30 minutes a day. So getting some type of exercise, walking, yoga, weights, whatever it is. And then other than that, they do mention like managing your stress, and there are some different ideas to implement into your life. They have journal prompts, you know, the way it's set up, it really sets you up for success. And the nice part about it is like the big group. So you can get put into a Facebook group. There are a couple of groups. So Young Living actually created a group, and then there is the original 14-day reset group. So either group or both groups, you're going to get a ton of support and information. And then the testimonials have just been absolutely incredible. I mean, my husband did it. My husband and I did the one at the beginning of this year, and he lost, I want to say, and I haven't even like done this testimony in the group or anything, but I think he lost 10 pounds in the week. And then he's just continued to keep up with the exercise and the water and drinking Ningxia every day and the dietary stuff. And now I think he's almost lost 20 pounds in a month. And he is just like, has all this energy. He feels amazing. And if it wasn't for me kind of like nudging him and saying, hey, there's this reset if you want to try it, I don't know that he would have done it. So it's pretty cool to have someone close to you in your life, like having these amazing benefits and being able to go into the group and just read the most amazing testimonials. I mean, and he didn't even do the measurements. They give you like different charts that show measuring different parts of your body and paying attention to weight loss. All he was doing was weighing himself, but he's like, dang it, I wish I would have done those measurements. I was like, you know, but it's a lot of fun. If anybody has anything to add, let me know if I missed anything. I don't know the date. If somebody knows, type in the chat or unmute yourself if you know the date that the next one starts, because we're in the middle of one right now. And you can start it anytime you want. I mean, all you need is 102 ounces of Ningxia. So they have the Ningxia Reset Kit, which is nice because it comes with packets and cute little notes that tell you, you know, day 1, day 2, and encouragement and stuff inside. But you can get bottles. I mean, obviously the best deal is probably to get, or is definitely to get the loyalty kit. I think that many people are doing it with the bottles, but the packets are kind of cute and it keeps people on track. So anyway, the next one is in March and you can do it anytime, but it's fun to kind of start and finish with the group. So that's the reset.
Thank you. Yeah, okay. March 11th is the next reset. The loyalty rewards bundle is your best deal, plus the ShareYL 10% off discount for new people. And there's 3 Facebook groups that these ladies who created the 14-day reset put together. So all we have to do is put people in there. So there's the sneak peek group that you can put anyone that's interested, and they just have tons of testimonials, education about what Ningxia is. And it's just a constant recycling of information, and then they keep adding more and more testimonials. The other group is the official 14-day reset group that these ladies created. There's also the Young Living one, but I'm just sending everyone to the main one. And then there is the Leaders Hub. So there's a group just for brand partners that has all shareable content, scripts, graphics to share everything that anybody that wants to do the business, just sharing about this. You can get access to all that information in the Leader Hub group. Okay. So it's been a phenomenal thing because everybody that does this, no matter if they do it full force or they just do it kind of half-ass, they have some kind of positive result. And when they have some kind of positive result, they want to share it, right? They want to tell their friends, and they know everybody knows somebody that's going to benefit from the 14-day reset. It's all based on getting rid of chronic inflammation and all the symptoms of chronic inflammation that are like, you know, headaches, not sleeping well, joint inflammation, digestive issues, skin issues, like pretty much everything that everybody has can be tied to chronic inflammation. And that's what Ningxia, because of the antioxidants and all the water and eating clean, and people that don't eat super clean and, you know, maybe your movement is just walking, they're still having positive results. So you don't have to go crazy. The beauty of the 14-day reset is you can do it as little or as hardcore as you want. And so lots of different stories. I know that Allie is super clean eater. She's super healthy. She doesn't have like an ounce of fat on her body. She has been drinking Ninja 2 ounces for 10 years or however long, and she got rid of 6 inches because of the reset, just from drinking more Ninja. She already does the water, she does everything, right? I did the reset half-ass the first time around because I was like, I want to do something that's like sustainable. I'm not going to do anything crazy, lose the weight and then gain it back, right? So I just did the Ninja, I did the water, I walked the dogs. I don't like flat ground. It's not like I didn't break a sweat. I don't like to sweat. And then we eat pretty clean. And I got rid, the first reset, I got rid of 2 pounds and almost 3 inches. So my husband got rid of 6 pounds and 6 inches. So there's tons of information, and the beauty of it is everything is already figured out for you. Like you can literally copy and paste and post the graphics, the testimonials. So it's a no-brainer, okay? And so that is one of the ways that we can now build the business solely on that program, right? You get people into the Ninja Reset, you show them the beauty of the product, they have positive experiences, then you start talking about oils. Then you start talking about the clean living. And in the 14-day reset group, they do talk about supplements, thieves, cleaning products, all those kinds of things, as like Ninja's the gateway, and that opens the gate to all the other products. So it's a really great way to build your business because you don't have to know all the things about all the things. You just need to know about the 14-day reset and Ninja.
Carol, there was also a stat on the Ningxia. It was like people who start with Young Living with Ningxia have a 90%, is it 90%, 89%?
Crazy like that, yeah.
Like it's a reorder rate of 89 or 90%
Mhm.
reorder rate, which is massive.
Yeah, yeah. So you get them on loyalty rewards to get that loyalty rewards bundle. You highlight the fact that like, yes, there is this very cute kit, but you only get just enough for this reset, which is great for people who are on a super, tight budget. Just get the kit, have them have positive experiences. But if they can order the bigger one, then you can let them know like you're going to have positive benefits and you're going to want to drink at least 2 ounces to 4 ounces a day just to continue until you decide if you want to do the next reset. Okay. So it's really just like a plug and play system with this whole reset, which is beautiful because it takes all the complexities of building this business out. The next thing that we're going to talk about is the health plan. So this is another way that you can solely build your business on this health plan. So I'm gonna, okay. Allie, can you make me host again? So I can share, okay, there we go. Let's get this. I gotta move you guys over here. Okay, and then I have to use this thing because I can't. Ugh. Okay. Okay, we're gonna go really quickly through this whole presentation. If you haven't seen this, this will be available for replay. If you have seen this, it's hopefully just gonna highlight some good important points. Okay, so there's tons of healthcare facts that show that the health insurance industry is broken. The one shocking thing to me was more than 65% of bankruptcies involved medical debt. And 90% of those people who had bankruptcy involving medical debt, 90% of them had insurance, which is crazy and sad. So the fact that we can now offer something that's better is just phenomenal. So Young Living plus Clearwater has created these health plans. And how all this began, I'm not going to go in the whole backstory, but I found something after we got rejected from our pediatrician's office because we hadn't been there in 3 years. Anyways, I brought it to Young Living Corporate. They had been approached by Clearwater. They asked me to talk to Clearwater to see if this plan was better than the one I found. Once I talked to them, I was like, yes, please, this is way better. And then we proceeded to create a custom health plan because they have had other companies white label their just plain health share program. But then once we started talking to them, it was me, Ali, and Yvonne. We had these regular meetings and we were just like, if we could have any kind of health plan we wanted, it would be amazing. If we could have this, if we could have this, if we could have this. And every time they came back and we're like, okay, we can do that. So Clearwater has been around since 2018. These Young Living health plans are brand spanking new, the holistic ones. The Clear Share portion of it, that's been around for a long time. So this company has been around since 2018. They've been in this industry of traditional healthcare and health sharing plans. Clear Share, the health sharing company part of it, is a nonprofit. So this is allowing us to just put the healthcare decisions back in our own hands and make the decisions that we want to make and not be tied to like, you have to see only these people in this network. You can only do this there. And so Ali came up with this little tagline, Clearwater is like the Young Living of healthcare, which is amazing. It's such a perfect partnership for Young Living. Nope, let's go this way. Okay, so what is a health share? It is not health insurance, okay? It is completely different. Health shares have been around since the 1970s. They have mostly been religiously focused. So you had to be a member of a certain religion or have your pastor write something or like have proof of tithing. And I've known about health shares for a while, but they didn't fit my needs because I am not religious. So this health share company is not religiously affiliated, but it's a community of people that pool their money together. So every month, all the members are paying a monthly share that goes into a pool, and that pool is how medical bills are paid. And so since the 1970s or something, there has never been a health share medical bill that has not been paid by any of the health share companies. That was a stat that I just learned about today. And so that's phenomenal. $1 multi-million dollar bills for cancer, for huge emergency surgeries, those kinds of things. They're all paid by the community, which is weird to think about. It's a completely different concept than traditional health insurance. But what we know about traditional health insurance is that it's totally, why does it keep going with this? It's totally for profit. Health sharing is non-profit. This one's a non-profit. There are some that are not for profit. But traditional health insurance, you're usually limited to a certain network. You've got all your deductibles, co-payments, and then even when you hit your deductible, then there's usually like a share where you pay 20, they pay 80, and there's a huge claims denial rate, right? There are doctors that traditional health insurance companies hire just to review claims to deny them. And so there's no guarantee that just because you have traditional health insurance that your bills are going to get paid. Whereas with health sharing, you've got an open network of providers. This one is you see whoever you want. You do have something called an annual max, which acts like a deductible. Once you meet that, then everything else is shareable. And this is basically just a really, really wonderful option for health coverage. Why does it keep going back there? Okay, we've got 3 plans, holistic plus clear share for people who want the blend of the holistic, but also have medical emergency care. We've got holistic, which is perfect for people who already have a great health plan, want to keep that, and they just want to add on a holistic option. It's also great for people who are over 65 who have Medicare. Then we also have clear share, which is just for the medical emergency care. So this chart shows you the things that are included. So this is amazing. You get emergency and urgent care for the holistic and clear share. You get $0 telemedicine, 24/7, 365 days a year, you will have an app on your phone. You can just click that button that you want to see a doctor. It can help you in an emergency-ish kind of situation where you're like, do I need to go to urgent care? Do I need to just go to the doctor? They can evaluate things. If you've got a cold, if you've got the flu, if you've got, something that hurts and you want to talk to someone, you can use this as if it's your own concierge physician. You won't get the same physician every single time, but you will have a doctor, an MD in your pocket 24/7. Care coordination services is an amazing thing that we didn't really even fully understand how amazing. So care coordination services is for any non-emergency medical situation. Maybe you need to get labs. Maybe you need to get an MRI. Maybe you need to get a planned surgery, like you have a knee surgery. If you call the care coordination service team and you use one of their preferred providers, your care will be free, $0, surgery, MRI, whatever. And the reasoning is they know that the people they're referring to, they usually refer to smaller surgery centers that have better outcomes than hospitals. They know that the providers that they're going to send you to don't hike their prices up like the hospital does. And so a surgery that might cost $300,000 in the hospital might cost you $60,000 at a surgery center because the costs are not jacked up, right? So ClearShare, Clearwater, the entire company, is willing to pay the $60,000 because they saved the, whatever the math is, 140 other thousand of dollars. So it's really, really cool, this care coordination service. You're also going to get $0 virtual mental health services. You're going to get 13 30-minute visits per year. And if you want more, you can pay $65 a visit. Childbirth delivery services with a doctor, an OBGYN, but also with a licensed or legally certified midwife. And it also includes home birth. $0 generics. If you sign up for the holistic plan, we got you a $50 to $75 Young Living supplement and oil reimbursement every single month. You get it? Like, that's brain exploding. When we brought this to Clearwater, we were like, we would love to have these products, Ningxia, our oils. Like, we know that these help us stay healthy. And they went to their actuaries, and their actuaries knew Young Living by name. And they immediately said, yes, no question. We know the scientific studies. We know the backing of the science of Young Living products. Yes, we definitely want to give you $50 to $75. So it's $50 for individuals, $75 a month for couples or families per month. And you just submit your invoice every month, and then you will get a reimbursement either in a check or a deposit into your bank account. So that's phenomenal. Everybody will be able, a family will be able to get a box of Ningxia pretty much for free every month. Then you're going to get functional primary visits, not just with a doctor, but with a DO, osteopath, with a naturopath, which is rare, a physician's assistant, nurse practitioner. You also are going to get chiropractic, acupuncture, IVs, and thermography. All of these visits are low cost. You're going to pay a per visit cost, but for the chiropractic and the acupuncture, if you go to the chiropractor and you get an adjustment plus some kind of maybe a laser plus some kind of lymph drainage thing, you're going to submit your entire bill, and then minus the $35 per visit fee, up to $175 is reimbursable. So they want us to stay healthy. We get 24 visits of chiro or acupuncture combined per person in the household. So that is a phenomenal thing. And then here's just a little bit more detail with the thermography. You pay $150, and anything else is included in the shareable costs with IV drips. you pay $25 for your visit, and then up to $100 is reimbursable. So that's fantastic. You're going to get $0 generic drugs and then low cost name brand. Okay, so we already covered that. I'm going to go through these pretty quickly, but these are the prices. There's 3 different tiers, just like deductibles. These are the annual maxes. We recommend the $5,000 annual max for any plan that has an annual max, because remember that care coordination service. Remember the $0 telemedicine. The likelihood you're ever going to really pay for this annual max is if you have some kind of emergency situation where you can't get an approval. And even if you go have an emergency situation without approval, you can still submit it to see if it's approved. But the likelihood you're going to pay your annual max is really, really low because of all those built-in things. And there's no limit on the number of your children, and it covers unmarried children up to 26 years old, even if they are not living with you, which is really, really amazing. Okay, so here's the plan for just the holistic plan. So this again is for anyone who already has insurance or someone who's got Medicare over 65. This one, there's no annual max. And there's also no issue with pre-existing conditions, which is really, really phenomenal. So you can go see all those holistic practitioners. Doesn't matter if you have a pre-existing condition. As soon as you have this holistic plan, you will be able to have all of those services and shareable costs. And here's the clear share only. This is someone who just wants the basics of coverage for accidents, emergencies, major illnesses. This is perfect for someone who's not into holistic health, that just wants to get the most basic kind of health coverage that's way better than any kind of government assisted free insurance that they're getting, because those free insurances that they get through Covered California or whatever are worthless. They have so many limits. The network is super small. You have to jump through a bunch of hoops. So this is way better. They will pay more, obviously, versus free, but they're going to get so much more in terms of services. The $0 telemedicine, the virtual mental health, $0 generics, all those kinds of things are included here. So how this works is Clearwater, how we got this done in such a short time is because Young Living didn't have to do any of the IT stuff and all the planning. So Clearwater does all of that. They do the health plan sign up, all the health plan education. They take care of payments. They have their portal access where we will submit our reimbursement things. Young Living will be taking care of the fact that we're going to get PV for this. So I don't know if you knew that, but we are going to get commission for these plans. Why did it go there? Good Lord. Okay. So you're going to want to sign up for the health plan, and it's a month-by-month enrollment process. So there's no like open enrollment. You just have to sign up the month before the plan, before the month you want it to start. So for February, you just have to sign up by February 29th, midnight Central Time, because they're based in Texas, so that you have access to all the benefits starting March 1st. And then Young Living health plans, you'll get billed on the 10th of the month. And then the PV is going to show up on the 25th of the month. So it's just going to bam, show up. We're working to make sure that there's some way that it's reportable, or we can run a report, or there's going to be a check mark or something so that we will know who is enrolled on the health plan. And then the PV will just follow normal unilevel Young Living commissions. So the reasons why we're so excited is this is just opening up a huge new door to income streams. People who want healthcare savings, people who want holistic practitioner coverage. You get to choose your own practitioner. Jessica and Nathan are going to talk about the income stream and just how amazing this can be. Like, you can build to silver really easily, and the OGV doesn't go away. It's consistent because everybody is going to love their health share and they're going to stay on it, right? So that OGV is going to stay every single month. So you're going to have increased retention and increased OGV. Not only are you going to have the increased OGV from whatever health plan they are, but if they are on one of the holistic, either the holistic only or ClearShare plus holistic, you're going to have that $50 to $75 bump up of products that we can educate them about if they don't know about Young Living products. That OGV shows up immediately as soon as they order. So you'll want them to sign up for the health share. So sign up in February, and then in March, they can start submitting their invoices to ClearShare to get that reimbursement. And obviously you're going to want them to put that on loyalty rewards, right? Because they're going to get that $50 to $75 every month of some kind of product, which is best for loyalty. Okay, so you're going to also have practitioner opportunities for sharing, right? All of the holistic practitioners that you know can now offer this to their patients. And yes, their patients will be able to pay less for their services, which means they'll be able to go see their practitioners more often. And so the patients are going to save money, the practitioners will get seen more often. And Jessica and Nathan are going to talk about how to share this with small businesses as well. So here's just a quick little idea of how impactful this can be. So I don't know why my printer is all of a sudden deciding to make noise, but hopefully you guys can hear me. Okay, so if you signed up for just holistic and you're like 40 in that 40-year-old age range with a family, it would be 517. If you just signed up for ClearShare, it would be 560. So you can see that getting the holistic with the ClearShare is a cost savings versus paying for each one of these individually. Then you get your $75 a month of product reimbursement. And so let's just say that you are on holistic plus ClearShare. Your average monthly PV that you're going to get from one person signing up their family for the holistic plus ClearShare is 158 PV. So if you look at this little chart over here, if you had 4 people, 4 families sign up with 158 PV, you would automatically be a star. And you just go up, keep going, right? If you have 64 people with 158, you would be silver automatically, right? You would need to structure properly, but you would have that OGV every single month, which is mind-blowing, right? And it would continue to grow and grow. So like, if you really wanted to, you could get to Royal Crown Diamond simply on getting people on these health shares. So who's eligible? There's the list. It is also available to people that are living in the US that don't have a social security card, but they have an ITIN. So that's a huge thing. And international people, brand partners can build using this plan because as long as they're signing up people in the US. We're working real hard on hopefully getting this plan to be international, available internationally. So that's coming at some point. What we do want to recommend is if you have a spouse, sign them up for a spouse account and roll the family on the spouse account so that you can earn commissions. And then how you're going to sign up, you're going to log into your Young Living account, or someone brand new is going to create their Young Living account. then you're going to click on the Young Living landing page. And then that'll take you to the Clearwater Young Living page. And then you just want to make sure that they enroll the month before they want the coverage to start. Okay, that is pretty much it. There's pre-recorded webinars, there's Spanish recorded webinars coming soon, and more plan options. Like, this is just phase 1. And there's way more exciting stuff in the works that we've got wheels moving and things coming. So just know that it's going to continue to get better and better. The website, the Clearwater Young Living website, is going to continue to get better and better. Like I said at the beginning, this is the first time Clearwater's done a custom plan. So that's never happened before. So just know, like, there might be a couple little hiccups with how things get processed, but the plan itself, there's no issue with that. That's solid and totally great. So now we're going to talk with Jessica and Nathan, because they have done all the math and all the ideas on how to share about this in a way to build your business. So go ahead and take it away.
Carol, thanks so much. That's awesome. You shared a ton of information. I think there was yeah, you just shared so much. And so just so you know, everybody, that all of the slides that Carol just went through, there is a link that you are going to receive on this Zoom that has all of that. So you can explain that to everybody. Yay, everybody clap. Carol, thank you. Like, Carol and Scott and and Allie and Yvonne have really been super instrumental in making this all happen for us. So again, thank you so much. So when I first talked to Carol about this, I was like it was a 45-minute call. I looked down the phone, I'm like, oh my gosh, I've been talking to Carol for 45 minutes. Everything that she was explaining to me was like, I was like, this is the implications of this for our business is huge. Like, it's really very exciting. And to have Clearwater and Young Living partner in such a forward-thinking way I loved it. And I was like, tell me more. This is exciting. And so again, we chatted for 45 minutes that first time, and I was like, I'm not ready to get off the phone, but okay, let's. So so approximately half of the US is self-employed or works for a small business. There's plenty of demand for this. Everyone needs either health insurance, or better yet, needs health plan. So we know, just to be clear, that this is not health insurance, it's health share, it's a health fund. Carol went over all of that, so I don't really need to kind of do that. And she also mentioned this is US for now. International plans are being worked on. One thing that Jason said, the CEO of Clearwater, was that if you live internationally, you can share it with people in the US, get them enrolled, and then those who live internationally, if they have connections here in the US, they get that OGV, that PV. So that's great. So it's not like we should just be talking amongst ourselves here in the US. And Jason, again, said he's like, things are coming. And as Carol has alluded to, there's more to come. So I'm really, really excited about this. So I think first of all, everyone just needs to go and get a quote. Go get the quote. If you're a member, if you have not been activated for a while, if there needs to be some reactivation, if you're not, Jess wants to type in the chat here. If you're at whatever stage you are, you've never heard of Young Living, you're a customer, you're a member who needs to be reactivated, you've been around for a long time, you need to get a quote. And go ahead and hit return. That's where you go and get the quote. Most of you know that. I'm just going to give this to you right now. I'm just going to give you these 7 links here now. Drop this in the chat. Oh, it's too long, it says, so I can't do all of that. Yeah, so we will, okay.
He's gonna keep talking.
Hold on, I need my notes though, real quick. So, just go get a quote. First and foremost, everybody should be reaching out to your team, right? Like, we can reach out to people who don't know anything about Young Living or HealthShare or Clearwater, but we should all be reaching out to, if you want to call it this, a warm market. Someone at some point in your organization has obviously purchased Young Living. So I don't know that we need to be reaching out to everybody outside of YL first. Reach down, reach across to anybody in Young Living first. That's number one. They're convinced of Young Living, they like it. And so yeah, I need my notes here, sorry. So yeah, reach out to your team, see if they want a better health plan. Again, 3 categories of care: Young Living, EOs, essential oils and supplements, holistic, and traditional healthcare. And so our personal situation, we just dropped Kaiser. They're an HMO, and we were paying like $15.50, and now we're paying $8.50 a month. So that's $700 a month in savings, and that's about $8,500 in savings. But then, in addition to that $8,400, there is the $75 reimbursement that turns into another $900 that's back in our pockets. So then we're at $9,300. So the savings in our situation that's the exact figure, $9,300, from the month that we start, which will be March 1 to end of February in 25. And of course, we'll do this in perpetuity. So again, we're just in a new season in Young Living. Like, this is exciting, and like truly exciting, because it's, again, not insurance, but you pay that monthly so that you've got your holistic care, you've got your Young Living products, and you've got your peace of mind knowing that you're only, maybe your out of pocket is $5,000 for the year. Carol, really quickly, I think Jason talked about the CEO of Clearwater. He was talking about the max out of pocket, and I don't know if that was, I don't know exactly what that was, and maybe we don't need to get into those numbers, but do you remember that figure?
I just know, so we're doing the family plan. I'm 54, Scott's 54. We're doing the 5,000 annual max. I believe the family annual max is 10,000.
Okay.
So once 2 people hit the 5,000, then everything else is shareable.
Yeah, I love another thing about this is that, like, there's no limit on children, which was funny. I saw that, I was like, okay, great. So if you got 10 kids, doesn't you got 1 kid or you got 10 kids, you're a family, or so there's couple pricing, single pricing, couple, and then family pricing.
Real quick, Miranda, I see your comment, you pay $300 a month. And I've had people say that on my things like, wow, this is expensive for me. Why is it $600? That's a lot of money. It comes from where you're coming from. If you have an employer, you're on an employer plan and they have great benefits for you, then this probably wouldn't work for you. I mean, maybe you have a great plan already, but for people like us that are self-employed, like half the country that work for small businesses, and they have to go find their own. I shopped around. I looked everywhere. The cheapest plan around was Kaiser, and the very cheapest rate for our family of 5 was $15.50 a month. So if you're looking at, a $600 a month payment or $500 or whatever your monthly is, you're like, wow, that's more than I'm paying. I understand. But don't think that that's the case for the whole country. Lots of people, I know people who message me and they say, I don't even have insurance at all because we can't afford it and we're both self-employed. There are tons and tons and tons of people out there that if you just start talking to people, they go, yeah, I can't afford it, or it's so expensive. Jason said the average self-employed family pays $2,300 a month. for
Mm.
health insurance. That's the average across the country. So even though like you might be saying, you know, I have this cheap plan, it's probably because your employer or your husband's employer or spouse has that plan.
Yeah.
But like you got to think about people across the country who would go, oh my gosh, I mean, $700 a month savings for us a month. That's $9,000 a year just for the it's not a premium that we pay, but our monthly pay. That's money back in our pocket. I had a teacher call me and she messaged me and she's like, oh my gosh, Jessica, this is so exciting. I'm a single mom. This is a way for me to save hundreds of dollars a month. It's amazing.
Yeah, and this is definitely a big deal. But Miranda, you're bringing up your own situation, right? That this is what I pay. I know my situation, and so this really should be hitting home for everybody. Everyone get the quote. Do the AB. This is the quote. This is what I pay. Look at what you're getting. The Young Living, the holistic, and their traditional care, and do the math. And think it through. And as Jason said, the Clearwater CEO, he said, this isn't necessarily for everyone, but it's for most people. And I love that he expresses that. So
So who do you talk to?
I think, let's see how much time. I think we're kind
Just
of
a
burning
few
the
more
clock
minutes,
here.
just a few more minutes on who do you talk to? Who do you talk to? So who do you call? Who do you reach out to? I mean, you can just walk through your town. We're going to have brochures for you. Wendy and Carol have both made brochures. So we're going to be sharing those in Spruce and other groups. So get some brochures made, go walk the streets of your town and talk to every small business. Just walk in the door and say, introduce yourself and say, hi, I am having a very affordable health plan. Are you self-employed? Would you be interested in learning about it? This is a plan. And we have a 2-minute call right now that just like it's a very short minute by the head of the company, Jason Shepard, I think.
Freeman, I think.
Sherman, I think. Anyway.
Is it Sherman? Thanks.
So a 2-minute video, we have the 1.5-hour long call, but we're also going to put together a slideshow based on basically what Carol just showed you, but a shorter video, maybe a 15 to 20-minute video that you can give to people. That's just a slideshow that Carol just gave the presentation. I was breaking it down for you that you can share with somebody so that can help them to understand in a shorter video what it's all about. And on there, Allie can talk about this, but we're working with Young Living to create a QR code that you can share with somebody from Young Living that will connect to Clearwater. It's not quite ready yet, but so you'll have your own QR code. So when someone clicks on it and they decide to sign up with Clearwater, that they automatically get through your member number. So that's coming very soon. So who do you talk to? 1099 employees, freelancers, any small business, anybody who works for themselves, entrepreneurs. It's half the country. It's accountants, it's lawyers, it's teachers, it's dentists, it's anybody who has a small business, anybody with 50 employees or less.
49 or less. So at 50,
Yeah,
50 or more, they are required by the ACA, the Affordable Care Act, to have insurance. So it's 49 employees or less. That's who we can reach out to.
So call like a painting company and they've got 30 employees and they say, yeah, our guys, my stepdad, great example. He owns real estate. He owns mobile home parks. He's like, yeah, no, our guys, we don't pay their insurance. They have to go buy their own. And he's like, wow, well, could we reach out to them, put them all on a call and say, that could be like 30, 40 signups all at once. You do a presentations and show them the plans and they're out buying private insurance because that's all they can have. Or maybe some of them qualify for the government insurance. But like Carol said, this is much better. And so you can sign up like 30, 40 people at once. And if you go back to that slide that Carol showed earlier, 64 enrollments at the average of 158 PV that's going to be their average PV coming into you. 64 enrollments would make you a silver. And that's if you started today, brand new. So do the math on what it would take for you. What kind of OGV would you need to go back to your previous rank or to go up to your next rank? What's your goal? Maybe you're a silver who's fallen back to executive and you want to get back to silver. Maybe do the math. What OGV are you missing? Are you missing 4,000 OGV? Are you missing 5,000 OGV? So divide that number by 158, and that's how many families you need to enroll. So who can you start calling? Get on the phone, go onto Yelp and just look at dental offices in Houston or pick a city don't pick a city in California, in my opinion, because we have this law here that you have to have insurance, and we're creating an HSA. But anyway, I'm not going to go into that. I would just pick a city in one of the 45 other states and just start calling and say, you know, introduce yourself. Say, we have this health share plan. Could I send you a video to watch? And then when you call them back, say, were you able to watch the video?
Yeah.
And what do you think? And you can talk to the office manager. You don't have to talk to the owner of the company. You can just talk to the office manager, because she's going to be the one who's probably going to want to enroll, you know? So talk to these people and just, you know, we'll put together some scripts. We'll put together some phone scripts for you, but just start reaching out to them. And you might think, well, I'm scared to call people. They're going to thank you. They're going to thank you when you show them how much money that they can save, and talk about that. The 3 key points, the savings, that's the most thing. Say the average family saves $10,000 a month. Would you be interested in taking a look at this? The second one is the out-of-pocket expense that they can save. That, like Carol said, there's no cap on how much they could save. Like, let's say their doctor bills, they have a major emergency and thousands of dollars. There's no cap on how much the out-of-pocket expense for these health shares. And the third most important thing, I think, was the doctors. You can go see anybody that you want. But these, you know, hit those 3 pain points for people, and they're gonna, it's talking about the pain point that they're having. If you talk about that and you show them a solution for their pain point, that's when people are gonna want to enroll. Most people buy things based on emotional decisions. And for me, when I decided, I looked at the numbers, I'm like, I'm gonna save $700 a month. Oh my goodness, that means I can keep my kids in their schools. That means I can, you know, go on a family trip. What can I do with $700 a month? I could put that money back into my business. It's very exciting. I used to work in finance for 14 years. And when I saw this, I love talking about oils. I could talk about oils all day long, but I don't know. I feel like sometimes people don't want to hear it from me. But when I start talking numbers and money, I did a post. Anybody can go look on my wall. I made it a public post. My name's Jessica Laney Petty. I posted this a few days ago. I'm still getting messages at the bottom of saying, hey, send me the link, send me the link, send me the link, because I talked numbers. If you read the post, I was very clear. I'm going to save this much per month, this much per year. I am so excited about this. And when you do a post, talk numbers, put exact numbers in your post. People are going to, their eyes are going to go, oh my gosh, really? Send me the link. But here's the thing. When you do your post, don't put the link in your post. Say, yeah. And then say, when people say, hey, send me the link, say, I'll message you. Do not put the link in your post. Otherwise, no one's ever going to message you. They're just going to go look it up themselves. If you want them to sign up with you, say, I'll message you. And then people keep saying, send it to me, send it to me. That's how I got into Young Living too. Melissa did that. She didn't put the name of the company. She just put the oils, and I'm like, what is it? Send it to me. So
Yeah. I think, yeah, we've shared a lot. Carol, did you want to open up for Q&A? I think that was next.
Sure. Yeah, I wanted to highlight California is one of the stupid states that doesn't like to recognize health shares. I think there's a couple other smaller states, Vermont or something. Anyways, those 5 states, California's the biggest one, does not recognize health shares as a Affordable Care Act compliant situation for your health insurance coverage. However, there's a couple workarounds, okay? So the first one is, if you aren't ACA compliant, you will pay a fine. It's not a big fine. For families, it might be a little bit bigger. I think, Jessica, you were saying that it was going to be like 3,000 something for your family. But if you look at the overall cost savings that they're having, paying 3,000 plus the health share, they're still saving a ton of money for having access to this. The second way is to have an HSA. So Clearwater is working on having a health savings account that you can add on that'll make you ACA compliant. So those are the 2 ways to deal with that.
And Carol, just add on that you only have to have it by December 31st of this year. Plenty of time to do that.
Yes. I'm not exactly sure what the other 4 states are. Okay. Yeah, so anybody have any questions?
The other 5, I think that it was California, New Jersey, Massachusetts, DC, Vermont, and I think
There were only 5, yeah.
Yeah.
So
Yeah.
thank you.
well, there was 5 in the District of Columbia. But
Oh,
yeah.
it's Rhode Island. Rhode Island.
Rhode Island was- So I just dropped in 3 links here. Yeah, not Texas. Yeah, not Texas. Heart that.
I'm putting in again, a Canva template. If you have Canva Pro, you should be able to copy and paste that. And then that has a trifold that you can use, maybe send it to Vistaprint or whatever. We're working on a couple other versions, and we're working on a version that's going to be low ink, so that if you want to print them out yourself, that will be available. How do we suggest this to people with an FSA?
An FSA is just like an HSA. It's an add-on. That's not coverage. It's just like, it's a way to use tax or post-tax dollars, pre-tax dollars. I can't remember. It depends on if you're self-employed or work for, pre-tax. Thanks. Yeah, so they work in conjunction. You can use your FSA. I have an FSA. I'm still using it with ClearShare.
So think about the practitioners that you know that are holistically inclined, the acupuncturists, the chiropractors, the naturopaths, the DOs, those people, the companies that do IVs, right? Like, you can go approach them and let them know, like, hey, there's this new plan that you can enroll as a brand partner for $1 plus shipping and tax, right? And then you can share that with your patients, because you already know they like these kinds of services. They can save a ton of money on their health, in like their health coverage, but they could also save money on their out-of-pocket costs seeing you, which then gives them more money to see you more often, right? So they're going to also get the ability to have their patients come in more often and add another stream of income, which everybody should be looking for ways to diversify their income streams, right? So having this for any small business, any holistic practitioner, is just a smart idea. So those people that you know, start setting up meetings. Just ask them, hey, I have this really amazing health plan that could really benefit you and your patients and give you an extra stream of income. Would you like to learn more? And then set up a meeting, maybe use that PowerPoint that we just went over, maybe just give them a brochure and meet with them in person, however you want to do that. Hayden, go ahead.
Yes, hi everybody. I'm excited about this. So I was talking to Jessica and Nathan earlier today, actually. So 2 things that I was just wanting to know about was, number one, obviously, I think you mentioned it. But like right now, I have 2 people who already are really interested in enrolling in this. But I want to just make sure I don't mess things up. So I sent them the actual like URL link for them to, find out if the quote, like the free quote link, do their own research, yada, yada, yada.
I wouldn't. I would actually have them create their Young Living account first and go through the Young Living website. That way your member number is already attributed to them.
So,
Right,
okay,
but
because that's what I was
the
going to ask.
landing page just got launched a couple days ago, so.
Okay.
Yeah, it's getting some tweaks.
So then if we go that route of just sending them, like if I did my share YL link, for example, what would they have to purchase, if anything, or nothing?
Nothing.
Okay. All right. Fantastic. So I could just send them that. They create their Young Living account link, and then they'll gain access to the Clear.
Mhm.
Okay. Perfect. Okay. I
Yes.
like that too. Okay, cool. Yeah.
Yeah,
Because
that way, so now that we have a Young Living landing page, you can create a deep link in that ShareWile section of the virtual office or the website. You just copy the HTTPS like website of the landing page, pop that into the link area of the deep link generator, copy that, and then share that. And then that way, when people click on it, it'll automatically attribute them to you no matter what. So whether they go off and look somewhere else, it'll still auto-populate your info. And any brand partner can sell it, can enroll people, but customers can sign up. So that's why just have them create their free account, and then they can sign up and learn about all the info through the landing page. The landing page will take them to the Young Living ClearShare website. that has all the info, all the FAQs. And just so you know, the FAQs are being updated on a weekly basis. They're still catching things that are on from their, old other plans that aren't our plans.
And then the last question that I have, which I know this is a doozy, so feel free to just, say what you need to say, but is there a plan in place for how to structure this, or are we working on it? So like, I know in Young Living, obviously the goal is to strengthen up your ideally 7 legs, right? Well, so obviously, are we just supposed to just worry about getting people, like getting bodies, and, don't worry about placing them, like if we don't have all the legs established, or that's kind of where I'm at. Is there going to be some sort of chart? Yeah.
I don't think there's going to be a chart, but what I usually recommend is start with 3 legs. That's going to get you to goal, but get those 3 legs at least growing, and then get your other 3 legs started so that those are also growing. You want 6 legs total. Eventually you're going to have to make $1,000 PGV, personal group volume, but really, like, if you're Royal Crown Diamond, whatever, you're gonna want that much product.
Right.
But
Right.
6 or 7 legs. So start thinking about like who that wants to do a business, who that wants to have another stream of income, have them at the top of the legs.
Okay.
Just create the 6 legs if you can now, right? But
Right.
and then just start putting people under those 6 legs. Ideally, you want level 1 top legs, people that are actually going to do the business, because you don't really want to have to do all the work. But the beauty of having this is that you're going to have consistent OGV showing up every single month. So it's not like you have to keep filling up that leg to keep it at the same level so that you can hit rank. The beauty is, once you have these people signed up, the majority of them are going to stay. Most people don't change their health
Right.
plans very often, right? So I would, start really brainstorming, like, who do I know that's someone that works hard, that wants a new source of income, who knows a lot of people, who's a go-getter, who's independent. I want them on my front line. I want them as my level 1. And then you partner with them to like collaborate. Okay, so this person, who do you know? Let's set up meetings each leg, or you set up meetings for all the legs and all the people involved, right? There's no fast start bonus for month 1, just because of the funky way that it happens. You won't get paid the first month, you'll get paid the second month. So you'll get fast start month 2 and 3. Okay, Yvonne?
So, Hayden, I was going to say, that's why I think it's important to explain that if you get on the holistic or ClearShare holistic, that your Young Living is reimbursed. And they're like, well, what is the Young Living? You're like, well, do you ever need oil? Do you ever have a headache? Do you ever need help with sleep? Do you ever need help with moodiness? Or do you have hormonal things? We have stuff that can support you, and this health share is going to reimburse you. And then that's where we get to, introduce them to all the things that Young Living has: cleaning products, the animal stuff, the baby stuff, the kids stuff. I mean, like, we have so many products, right, that we can get reimbursed. It's products or supplements, and there's a ton that we can share with people. That's how I'm talking to people about it. Like, I'm talking to my customers and my brand partners about what they order, and wouldn't it be great to get them reimbursed? Because that's all we've ever talked about. Wouldn't it be great to be able to go to a doctor that wrote a prescription for supplements and they were Young Living and I could get them reimbursed? Well, guess what? Now we have it. We don't even need a doctor's prescription. We just get to send our invoice in every month and get it reimbursed.
This is a total tease. This was a tease that Jason Sherman gave us, the CEO. And I don't know when this is going to happen, but I'm just going to tease you guys because I think you guys have been around Young Living for a while. But the free telemed, the end game for the free telemed is that those doctors on the other end have the essential oil reference guide. And when they diagnose someone, they'll be able to say, Jess before I write this prescription, just so you know, you might already have these Young Living oils and supplements on hand. You might want to try these first. How amazing is that going to be, y'all? I'm just a little tease because I'm like super excited about this.
Yeah. We don't know when that's gonna happen, but it's gonna happen at some point. So that is gonna be mind blowing and just a huge game changer because they'll be able to see on their end that we are with the Young Living plans and they'll be able to give those options. And just know again, like they're coming up with more plans that are even more affordable. Like they're also working on sometime very soon creating some focus groups for each plan or whatever, just so that they can get feedback. Because again, this is the first time they've created a custom plan like this. And they just make sure that what we offer is going to be phenomenal for everybody. So the 65 and up, if you have Medicare, then you can sign up for the holistic only plan. Because you're not going to not do your Medicare. I mean, some people choose not to, but most people are just going to get their Medicare covered. Okay, so yeah, so there's just, I mean, with the reset, with getting rid of CV, with this health plan, like now is the time to be jumping into your business and going full force and doing what you can. And the beauty of it is that because of the health plan stuff and the OGV staying every month to month and month, you aren't going to burn out, right? Because you're not going to have to keep replicating that all on you or only on like a certain few people in your downline. Like you're going to have that OGV month after month. It's only going to show up on the 25th of the month, but but it's going to be there, and that process will hopefully show up even sooner. They just have to work out timing wise, billing with Clearwater, sending that info to Young Living figuring out programming that all into the, into the VO and all of that. So, it's just going to keep getting better and better. So right now, what we have is fantastic and it's just going to get better. So I hope that this helps inspire you about growing your Young Living business. We've got so many options now that just make it so easy to do this business. So we're going to start having monthly or weekly calls Mondays at 5 on the same link, and it'll just be a brand partner business call where we can just kind of chat and strategize and share ideas and that kind of thing. So know that that's on the schedule. The link for the video is just the link that's on the website of Jason Sherman talking about the health share. So can probably just go to the website and then click on it. I believe it's a YouTube link. So that's there. Yes, this replay will be available in Spruce Society and on the Spruce Society YouTube channel for our team. If you have other questions, we'll be around. Okay. So thanks everyone for joining us. I hope you're as excited as we are about all the wonderful things available to us. And I can't wait to see everyone's OGV grow and grow and grow and people rank up. Okay, thank you. Bye.